This is a brief overview of the Acute Care Simulation Lab at the IHSC, demonstrating the various equipment available for students for use during sims. On the west wall is a countertop with a fully functional sink, soap dispenser, paper towel dispenser, and hand sanitizer. Students are expected to use the sink like they would in a clinical situation. Next to the sink on the wall are exam gloves in small, medium, and large sizes. There is also a sharps container for used needles and glassware. On the counter there are 3 milliliter, 5 milliliter, and 10 milliliter syringes, saline flushes, needles, alcohol wipes, and tourniquets. If needed, there is also a laminated sheet showing the various colors of blood draw tubes and what they test for. If the preferred method of blood draw is with the butterfly collection kit, those are available in the supply Pyxis. If needed, there are drawers below the counter which have blood pressure cuffs, a thermometer, stethoscopes, as well as oxygen supply items such as a nasal cannula, mask, and tubing. At the end of the counter is a fully functional PC with internet access should the scenario require its usage. Nearby is a phone to the operator. During a scenario, it may be required of a nurse to use the phone in order to contact a doctor, pharmacist, or a technician. To do so, press the OP key on the phone to contact an operator. Behind the patient monitor, at the head of the bed, are outlets for vacuum, air, and oxygen. These are active, working outlets and should be used as they would in a clinical situation. The bed is locked in place by default. If needed, the bed can be unlocked in order to be moved around. To do this, step down on the green pedal near the head of the bed, or lift up the release at the foot of the bed. Note that when the bed is released, a loud, audible tone will sound. Lock the bed by stepping on the red pedal or the foot bar. The patient monitor displays all the vitals of the patient. In some scenarios, ECG leads, blood pressure cuff, and O2 sensor must be placed on the patient. In other scenarios, these will already be attached. If they are not on the patient, they can be found coiled behind or on top of the patient monitor. Once they are attached, they must be activated by tapping the patient monitor to connect them. The patient monitor features a full tap screen. If a window displays that is not needed, pressing the large X at the top right of the window will close it. Blood pressure can be taken by tapping the Start/Stop button at the bottom left of the screen. Keep in mind that this does not take blood pressure continuously. To receive new blood pressure readings, you must press the Start/Stop button again. On the bottom right of the screen is a double arrow button. Tapping this button will present additional options. From left to right they are called Radiology, Media, Labs, and 12-lead ECG. Tapping 12-lead ECG will present a 12-lead ECG trend. To close this window, you can tap the Close button on the bottom of the window or the large X at the top right. The scenario may require you to order X-rays or labs. To do so, you would tap the Radiology or Labs button at the bottom and then Order New Labs or Order New X-rays if none are available. To close out of this screen, you can press the Close button at the bottom right or the large X at the top right. Occasionally, a scenario may require labs or X-rays to be sent to the patient monitor without being requested. In this example, a lab is sent to the monitor for nursing students to observe. Labs and X-rays may have additional information that is not immediately displayed. These windows can be scrolled with a finger like an iPad or smartphone in order to reveal more information if it may exist. To return to the patient monitor, the window can be closed with the bottom right button or the top right X. Labs and X-rays can be viewed again by tapping the Labs or X-rays button at the bottom. Doing so will list the labs and X-rays sent to the monitor. Tapping one will display it. To use the drug Pyxis, tap the screen and log in with the username nurse and password nurse. Both the username and password are also printed on the Pyxis machine. To dispense a medication, log into the Pyxis and then tap the Remove button. A list of patients will be displayed. Select the patient and then tap the Item List button at the bottom left. a list of medications will be displayed. Select the required medication and then tap the Remove Items button. In this example, albuterol will be selected. The drawer with the requested items will unlock, allowing you access to the requested item. Once the drawer is open, the Pyxis will now ask you to verify the amount of items in the pocket. If the amount is correct, tap the Yes button and then remove the item needed. Enter the amount you are removing and then tap the Confirm button. Close the pocket if one is open and then close the drawer. The Pyxis will now display the patient list again, where you can start the process for selecting a new medication, or you can tap the Exit button at the top right if you are done. Don't forget, if you have trouble with the drug Pyxis, you can call the operator and request help from a technician or pharmacy staff. Next to the drug Pyxis is the supply Pyxis. The supply Pyxis contains a number of items such as Foley catheters, various gauze pads, IV bags, and dress change trays. It's important to note that not everything that is available in the supply Pyxis is visible, since there is a drawer with smaller items such as blood collection tubes, butterfly kits, and piggyback connectors just below the screen. Below this drawer is the keyboard you will need to access the supply Pyxis. To use the supply Pyxis, log in with username nurse and password nurse, both of which are in lowercase. This will present a list of patients. Tap the patient you'd like to check out an item for. This unlocks all the Pyxis doors to check out items. In this example, a Foley catheter and a dress change kit will be taken. Take the item and then press the Take button below the item. Do this for each item you take. If you take more than one item, tap Take for each one. The screen will display a list of items that have been checked out. When you are finished, tap the Exit key at the top right of the screen to finish your selections. A printout of your selections will be made. Leave this for inventory purposes. Just a few rules to remember when you step in the lab. First, betadine or iodine cannot be applied to the mannequins, as this stains the skin. Act as if you are applying it without opening the packet. Second, the mannequins can simulate quite a bit, but they cannot swallow meds. If meds need to be given orally, say, "Here is your medication," and gesture with a medicine cup so that your classmates and instructor know that you administered it. Next, don't talk about the simulation with others who have not had the simulation. It's important for all students to experience the sim lab with fresh eyes. And last, please wear your nursing uniform when conducting a simulation. Students wearing street clothes will not be allowed to participate in simulations. And that's it. Thanks for watching.